Welcome everyone to the next in our series of webinars dealing with Mussar in the workplace. Our technical host, Evan Silbert, will be on in a minute. He's having some technical problems of his own. So this is Jeff Agron with the Mussar Institute. And I see that we have a bunch of people on this webinar will be recorded as well, and a link will be sent out after the webinar. So I would like to make sure that people can hear. If people want to send a chat message at the top, there's a chat button. If you double click that, it'll take you to the chat box. You can click the participant button again, double click it, and it'll take you back to the main viewer. And we'll leave some time towards the end of the session for questions and answers. And the best way to do that will be to either put them in the chat box, or since we don't have, even though we have over 100 people signed up, we don't have a lot on live. Most will watch it by recording. And you could probably unmute yourself and ask the question as well. It seems that everyone is muted now. Dr. Henry Wodnicki is our presenter today, and Henry, I don't see, can you hear us okay?
Sure.
Okay, great. So I'm going to turn off my camera and my microphone, and everyone should be able to see Henry in their main viewer. You can also move your cursor to the main viewer and double click it, and it will take you to full screen mode. There are no slides or anything to go with this presentation other than the introductory slide you see at top. And so there's no slides to be worried about during the course of the presentation. So if Evan can hear me and he's able to record, please go ahead and start recording. And so I'd like to introduce Dr. Henry Wodnicki, who is sort of a neighbor of mine. We both live in the Miami area. He's a physician on Miami Beach. I will let him tell you more about himself and what he does professionally and his connection to Mussar and how it relates to his work. So, Henry, I'm going to...
Okay. I'm not sure. I'm not that computer literate, so am I on now?
You're on, Dr. Wodnicki.
Am I on?
You are.
Okay, good.
You're all set, sorry.
I'm sorry?
Go ahead.
Okay, good. I'm not that computer literate, so bear with me when and if there's anything that you can't hear or I touched the wrong button, kind of let me know. I am a colorectal surgeon at Mount Sinai. I've been practicing in the area for about 30 years now. Being a surgeon, you are exposed to a lot of people with a lot of problems. Before I get started with that, I just wanted to kind of give you an introduction to how I got into Mussar myself. About 10 or 11 years ago, my wife was taking and getting her master's in Jewish studies here at the Federation. One of her classes involved a lecture by Alan Moranis, and he impressed her so much with the whole concept of Mussar that she thought that I would be very interested in it. I, at the time, had no idea what Mussar was about, but got involved with the Mussar Institute at the time and have taken probably every single course that they have offered, including Manhim, and I've also had the opportunity to actually teach Mussar to the Melton program here in Miami. With all that aside, one of the things that impressed me so much about Mussar was the impact that it had on my life. I originally, being a surgeon, and I don't know how many surgeons you know personally, but being a surgeon, there is a certain amount of stress, and there's a certain personality that we all normally present ourselves. There's a tendency for us to be very demanding, most of the time short-tempered. We all feel that we are the most important person in the room. Sometimes I think we are, but we're supposed to be. And there's a certain aura that we present to people. Since I've been starting, and I've gone through the, I guess, my own path with Mussar, I've been able to look into myself, and I'm able to see things and do things now that I was never able to do before. One of the biggest things that is at least the most important part or the most important midah that I personally think is the midah of equanimity. And the shlemut that you must have in order to be able to do what I do for a living is important. The ability to be able to experience with my patients the various things that people are exposed to. I see a lot of people in their worst times during the time that they are diagnosed, most of the time with a disease that can potentially either cause them to pass or affect them for the rest of their lives. Early on, when I first started doing this, before learning Mussar, there was a certain amount of, it was difficult to come home sometimes at night because of this. You know, you tend to see people crying, people experiencing a lot of very difficult emotions, and it's hard for anybody to separate yourself from this. And once I started doing Mussar, I was able to, in myself, help my patients. Now, since I've been with Mussar, there have been certain very specific midah under which equanimity, where we can use to keep this balance, this shlemut. As I had mentioned before, surgeons have a tendency of feeling that they are the most important thing in the room, and the midah of humility, the midah of kindness and compassion have helped me with patients that have had experience with this. Seeing that I, in myself, have been able to at least have this shlemut, I'm now able to help patients. An example of this would be somebody who would come in who has been recently diagnosed with a malignancy of cancer, and I'm supposed to be helping them, or I'm going to be helping them, but you can't just do the actual surgery of which I do, but there's more to it than that. And this is what I realized after starting Mussar. There's a tremendous amount of anger at the fact that they do have the malignancy. They're angry at everybody around them. They're angry at the maker of all things. They're angry at, why me, and not some evil person. And this is one of the beauties of Mussar. You have to, and I've realized once I've done this, that the soul, the spirit, is as important as the actual medicine, the actual taking care of somebody. The spirit, the whole body, the holistic part of medicine has been lost by a lot of people. With Mussar, as I'm sure most of you know, anger comes from, at least my impression of it, anger comes from our inability or our feeling that we should have control of everything. We should have the ability to take care of it. We should have that we should be able to take care of it and in control of our destiny, in control of our future and our plans. And spending the extra time that I do in this when I see this in people, helps people work through that. It's the understanding that we are not in control of everything. In fact, we are in control of very little, and it's the maker of all things that controls our existence. It's also the concept that we are just players in a very, very, very large stage. We only know the next couple of words in our lines, as an analogy with theater, but we only know the very little part of what's in front of us. We don't know the full scheme and the full plan. Once we have a concept of this, it's interesting how people are much able to handle the problem and also able to actually help in their care. It's incredible to see the transition. but it's also very hard to be able to have people actually see that concept until you're able to actually sit down and talk with them. In addition to that, the concept of compassion, the concept of the kindness that we're supposed to actually present to people. My office people, when I sit down with them, I spent a long period of time, once I started to do this, I started to teach my office staff, specifically my staff that, well, my whole staff that interacts with my patients. Examples are starting from the person who actually answers the phone. People call because they're sick. People call because they have problems. Sometimes because of the fact that they are not because of their being sick as they are, there is a tremendous amount of, focus. I need to be seen yesterday. I need to be seen like in 5 minutes. And my office staff obviously has to handle a lot of this, and sitting down with them and explaining to them the concept of humility, the concept of that sometimes people have, because of their sick, they feel that they have to be taken care of before other people. You see this also in the emergency room, that they have to have a certain amount of compassion, that they need to be able to project this to other people in order to be able to have them feel that they are, and they are, of course, but the perception that they feel that they are important, that they are being addressed correctly. I know a lot of people who've touched upon the medical field. Sometimes the people in the front are very callous, and this is something that is, I'm glad that I was with my people able to present that. I at Mount Sinai have residents, and it's fascinating to see how little when residents come out of medical school, how little they have exposure, and I guess it also happens in yeshivas, that the concentration is so much on studying, so much on getting every little bit of fact into your head, which is of course very important, but the other side of it, the side of the spirit, the side of the soul, the side of the person themselves is not addressed, or it's addressed so little that you can see that in my residents. I have thus the opportunity, and I'll tell you that it's interesting to see when you're able to address this with them, the change that occurs with the residents. I have the opportunity of doing this in small groups as well as in one-on-one as I make rounds with my residents. I teach them humility. I teach them to be generous, to actually show gratitude to everybody around them for, what they're experiencing. It's funny to see how when residents first interact with patients in I would say the first year after medical school, the transition that I'm able to do with them with Mussar. Patients do better. Patients have, when there is a relationship and a trust and a confidence between people, when you give the patient the kavod that they deserve, something that is lacking in a lot of what medicine is about today. And you see it not only, I don't not only see it in my profession or my area, but you see it all around. The kavod that is needed for just simple respect for the person that you're dealing with seems to lack. I mean, I'm sure a lot of people go into hospitals and the first thing they do is they give you a gown with the backside open. Talk about lack of kavod, right? People, physicians, and I watch my colleagues do this all the time, where they go into a room. A lot of times it's not even a private room, it's a semi-private room, and in full voice, you start talking about, personal things. I mean, it's just not. You're taking away some of the person's own space, and you put people in a very, very, very compromised position that they tend to do less well than somebody that you are able to consider as part of the team. My patients, I always tell them, are part of the operating team. Probably the most important part, at least in my mind, besides the actual medicine, in helping them get better. Somebody who feels the respect, the honor, the kindness that you can give somebody, especially in the hospital, in the office. These things go to helping patients actually get better. I can't emphasize enough how well and how quickly people respond to this, to the concept of the kindness, the concept of being part of the team, being part of their own care. People ask questions all the time, and I mean, I'm sure that a lot of people that I'm talking to right now when they go see their doctor, I would talk to, explain what's going to be happening, and the comments I always hear is, I have a question. I think it's kind of stupid, but I'm going to ask it anyways. Well, my first comment, even before they say this, is there's no such thing as a stupid question. Because if it's a question that's important enough to ask me, to address to me, it's the most important question in the room. The most important that's been said in the last 10 minutes. Simply because this allows people to get to participate, to give them their kavod. Now, family members, it's also really important. Not only do I talk to my patients, family members play an important role in care of patients. In addition to spending time with my patients, I also spend a fair amount of time with family members that are involved with the patient. Sadly, I see a fair number of older patients in the area who either have no family, or the family is, I like to say the word, distant, and not only distant physically, but distant even in knowing or being part of the patient's life. And that is sometimes real difficult to see in the patient's eyes when I start talking to them and ask them who family-wise I should be, talking to and giving updates on what's happening. The people who are involved closely with care also have a lot of issues, and they also need the same attention. The need for the compassion, the need for the kindness, the need for the kavod that the patient needs, as well as the family. And I spend a long time trying to help them through this. And again, it's once you're able to just present it to somebody, and it's almost like their eyes opening up to a concept, to a paradigm that most of them are not even privy to. And again, doing all this really is something that is astounding. I mean, I can't talk more about, the feeling that I get when I'm able to help people get to this level. As I started off in the beginning, as I said, the concept of this equanimity, the concept that we are like on an ocean, that there's going to be ups and downs, that there's going to be good, there's going to be bad, but that the overall place that we will end up will be a place of peace, place of calm, at least knowing that what can be done, what has been done, what will be done, is the best that we all can offer. Is there any questions, anything that, any comments that anybody wants to ask me or talk to me about?
Okay, Dr. Wodnicki, Ken Elman has a question, and he would like to know, when you teach your students or office staff, do you teach it as Mussar per se, or do you use a different terminology?
No, I use it specifically as Mussar. Most of my office staff knows, and I can tell you that I've had most of the people that have been working with me have been working with me for at least 20 years. And while I was personally studying Mussar, they noticed a transition in me. And then I basically told them, let me teach you some of what I am learning. And because when they saw the change in me, they wanted it too. And I presented as Mussar. My staff is not Jewish. My staff is primarily think of any religion, and they're there. But I presented as Mussar, and I presented just as I was taught. And it's fascinating to see how the concepts are universal, and they soak it up like a sponge. Any other questions?
Hi, Dr. Wodnicki. It's Evan again. There's a question here from Alex.
Yes.
Alex Fisher, are you there?
Yes, I'm here. Can you hear me?
Sure.
I live in Canada, and the health system here is social. So we don't pay. We just pay monthly fee for it. And the culture in Canada, or this where I live, is the culture of bullies. And the biggest bullies are the doctors. And I just had a surgery that was not very successful. And I was emotionally abused by a doctor. And I responded. I just stood up to him and I told him that he was mean and nasty. And I'm just wondering if there is a way that I could get some of this information in writing, or that I could send it to those doctors who have been taking care of me and who are real bullies. Is there a way that I could have access to this information, what you just talked about, and email it to them or present it to them in writing?
I can tell you that that's a 8 to 10 year training, but I mean, we have the Mussar Institute, which is an incredible resource for a lot of this stuff. And I mean, I could try and put something together for you of some of the things that I talk about and send it to you if you'd like.
I'm Jewish. And not only that, but a lawyer told me that the best doctors, the best students who graduate in Canada move to the States to work there. And Canada is left with a mediocre doctor in general. There are, of course, are good ones. They're good surgeons, but the majority are mediocre. And they're arrogant, and it's really, my experience here has been really, really bad. I come from Mexico, and my experience in Canada has been horrible. From the people at the front, from the nurses, they treat us like garbage because we don't pay, because it's a social medicine, and it's really, really bad. And so I don't know if I could get something from you. I would really appreciate it. I would take it personally to those doctors who have treated me before.
Okay. I think the best way to do this for you would be to send something directly to the Mussar Institute, which I'm sure will get forwarded to me, and I will try to just sort of send something for you to be able to present that. The problem with anything is that the person who you're giving it to has to be willing to accept it and not accept it by just accepting it on paper, but to be able to incorporate it within their themselves. And this is something that has to be done, I guess, gradually. It can't be done completely. On commenting on the the medicine in Canada, I will say nothing because I don't practice there. I have lots of friends who've moved down here from there, but I cannot comment, and I'm not sure that it would be appropriate.
Thank you, Dr. Wodnicki. There's a question here from Howard. Can you summarize what you teach your patients about Mussar, and what do you tell your patients about how Mussar can help them?
Oh, I use that. Oh, that's a very excellent question. I'm sorry. The best way, the best summary that I can give them is me. I tell them that I've been studying for a very, very long time, and I tell them that there has been a significant transition in me over the course of years. And I know Jeff a long time, and Jeff knows me a long time, and he knows that both of us have gone through our path. I use myself as an example. And when I tell them about Mussar, and I say to them, they say, "Wow, this is such a great new concept." And my comment has always been, and always has been to them is, "Gee, it's only like 500 years old, and some of the teaching goes back 3,000 years. So it's not a new concept." And I make an effort to tell them that it has changed the way that I look at things. And when I start to talk to them about what's personally going on with them at the time, and I give them just a little bit of what I can see they would benefit from of Mussar, their eyes are in, like, there's such a transition that you have no idea. And a lot of this, I have people, example, I have somebody who I took care of for a malignancy. This particular person survived, and it's 10 years down the line now, and has been my patient. Just comes back once a year just to talk to me. There's nothing for me to do for them anymore, but they just, it's almost like, coming back and, just re-energizing themselves. And it's really, to see it is beautiful. And I can't express, there's no actual words to express the feeling.
Thank you, Doctor. Howard, does that answer your question? Your live question.
I'm sorry?
Howard, does that answer your question? You're live. Well, hopefully. Are there any other questions? Please either use the chat box below or use the hand raise. I don't see any particular questions now. I'm looking at the chat box, and I don't see the questions. If you want to continue, Dr. Wodnicki, or whatever you'd like to do at this point.
Well,
I'll hold on a second. We have a hand up. Yes, who's talking?
it's Eileen Nathanson. I was wondering if Dr. Wodnicki could share with us which particular practices helped him increase his level of equanimity?
That's an excellent
Did you hear
question.
that, Dr. Wodnicki?
Yes, I did. That's an excellent question. And I will tell you that I do a lot of meditation in the morning. And I just contemplate on just the previous day. And try to draw in all of the midah that I was taught over the years to try and, keep me level. I mean, we're only human. And to think that when something wonderful happens, we all know that, the other shoe will fall. And I look at, the best way I can to say it is I look at praise and I look at criticism, and I feel the same for both. I will try to listen to criticism and correct it, and when somebody gives me praise, I take it as on its face value, but I also look at how I can do it better. So I spend a lot of time meditating, and I spend a lot of time using all of my midah in the course of the day to keep me in shlemut. Any other questions?
Thank you, Doctor. Are there any other questions? Either you can unmute your mic and ask them, or you can type it in on the chat room. Dr. Wodnicki, you seem to have answered every question.
Well, if there's any other questions, that people think about after the webinar is over, feel free to email me. I guess you can do it through the Mussar Institute, and I will answer every email. I hope everybody has a wonderful day.
This is Jeff Agron. If people want to email the Institute, they can email directly to me, to jeff@mussarinstitute.org. It's jeff@mussarinstitute.org is my email. And I will forward those to Dr. Wodnicki. And if you have any further questions, you can go ahead and send those to me as well, things you think of. We will be sending out the link to this session later this afternoon or tomorrow morning, so if people want to go back and watch it. And for the, I think there were about 115 people who actually signed up, so our experience is most people want to watch the recording, and so that's why we send it out, and it will remain up, and eventually will hopefully go on our YouTube channel, so it will be there as well eventually. So thank you, Evan. Thank you, Dr. Wodnicki.
And I want to thank everybody for participating.
Okay, thank you very much. So Evan will, I see, was there one more thing in the chat box? No, just, that's it. From
One more
Rosie
thing.
just somebody saying thank you so much. So it was greatly appreciated. And Evan will end the session for us and stop the recording. And people can just close out their window, and you'll be taken away from the webinar. So thank you, everybody. Have a great day.
Jeff, have a good day.
You too. Thanks so much. Bye-bye.
Bye.
Logging off.